Frank is an engineer, retired engineer, winemaker. Very interesting chap. Has made many bridges around Perth, and he's now in his retirement years. And he's come to see me because he's retired now. He just wants to get his teeth fixed. He's actually been to a lot of dental practices where the main concern he had was that he was always being moved from one practice to the other. One person would do, say, implants for him, the other person would do the crowns for him, another person would do root canals for him, another person would do his gums for him. He really wanted a solution where he could come to one place and really get all of his teeth worked on. So when he came to see me, naturally you can see he's presenting a plate, of course, is going to be the missing tooth at the front. He's broken a tooth. He has broken a tooth because he's a very severe grinder, and when people grind, they wear their teeth down. When they wear their teeth down, they gradually get weaker and weaker. When you see his teeth in close-up, you can see he's got very, very short teeth. His lower teeth are not there. In fact, he's one of the cases where they grind their teeth so far down that they actually expose the nerves of their teeth. So what you're seeing here, where you're seeing the white fillings on the top of the teeth and you see how this tooth has gone dark, is the tooth has died. He's worn so far through that the tooth has actually died and they've needed to take the nerves out. He has tried to preserve his top teeth as much as possible because they're the teeth he's going to be smiling with, and what he has had done is just basically some crowns, some white fillings to try and build up these teeth. The reason why front teeth tend to wear down is because usually there's a lack of back teeth. So when you start looking at some of these back teeth, you can hardly see that the teeth are there. If we look at, for example, the front teeth, again, in close-up, you can see how worn down they are, but his back teeth are almost not there. Most of these back teeth had to be taken out. They're so far worn down that there's just not enough tooth to even put any porcelain or to build these teeth up. So in these situations, the teeth need to come out, and what we've done is we've built these teeth up in porcelain and implants. So you can see there the very, very short lower teeth compared to the top teeth. So that gives you an idea of how much vertical height, much height of his teeth he's actually lost. From here, what we've done is we've actually started building his back teeth up. We've done some implants, we've put some temporary teeth over the top, and we started to build these teeth up to their correct height. So this is Frank with his temporary teeth. He's just smiling. Again, we're using these temporary teeth just to convey and to communicate whether he's happy with the shape and the texture and the size of these teeth. If he's happy with that, then of course we'll go through to make the porcelain. These are his porcelain teeth. The tooth is back, teeth are to the correct height here. Again, the harmony is placed. One of the things he actually did say to me is he wanted these teeth to look natural. Someone that's in their 50s and 60 years old, they don't want their teeth to be sparkling white. They want a natural smile. They want a smile that reflects their personality, but also reflects their age. They don't want people to walk up to them and say, hold on a second, I think you've had your teeth done. So in these cases, we do a lot of texturing. You can see here we've done some staining, we've done some check lines. We're trying to create natural teeth so that they're in harmony with the rest of his face and his smile. So there's Frank now in close-up. You can see he's smiling. If we zoom up to his smile, you can really see that they do complement his face very, very well. And this is actually several years after we've done the case. Grown a moustache, and his teeth are beautiful, and he's very, very happy with the end result.